My name is Nikita, and I'm a fourth-year immunology major, and I completed my practice experience at La Clinica in Oakland. La Clinica de La Raza is basically a community health center that focuses on underprivileged and underserved communities and trying to provide them affordable healthcare and healthcare resources. And basically, my practice experience comes in trying to, work in the preventative healthcare unit. So we're trying to give more affordable ways of preventative medicine and trying to alleviate the chronic illnesses that perpetuate through these underserved communities, and trying to give them a more affordable way of trying to live their lives without having to constantly come into the health clinic on a daily basis. So during my practice experience, I generally came in and I would, meet with patients and try to interact with them on educating them on, the nutritional side of how to stay healthy and how that has an impact on preventative health and how that all ties back into keeping a healthy lifestyle and how that can also impact their ability to not have to always come into the health clinic on a daily basis. So one of the projects I was put on was a diabetes self-management program where people that are predisposed to or on the way to getting diabetes would come into these workshops or have that opportunity to come into these workshops to learn how to better manage their care on their own without having to actually either succumb to getting diabetes and manage their healthy lifestyle a lot better. And basically empowering families and patients to take control of their own bodies and trying to make sure that their care is put into their own hands and giving them affordable ways of managing their own health without having to come in and receive actual medical treatments. In medicine and the healthcare system, there's a lot of debate over the role of doctors and how they play a role in perpetuating global poverty and underprivileged communities in their unaffordable access to healthcare. So, understanding that, in the career that I'm planning on choosing, how that can fit into either perpetuating the system or, changing the system, it definitely puts into context, how my own contribution into the medical community can definitely make an impact on the future of healthcare and how that can impact communities like the one in Oakland.